Thank you very much, Presiding Officer. At the weekend, SNP members met in Dundee to have an independence conference. During Humza Yousaf's speech, a brave woman spoke out. Theresa Mallett protested on behalf of herself and a group of more than 100 other patients of the disgraced surgeon Sam Eljamel. Dr Eljamel left NHS Tayside patients who came for help scarred, broken and devastated. Theresa wants answers. She is demanding a public inquiry. But when Humza Yousaf was Health Secretary, he refused to grant one. So can he tell Theresa and all of the victims of Dr Eljamel why he refused to grant that public inquiry?
First Minister.
Presiding Officer, I have agreed to meet with Ms Mallett and I'm due to meet with her, I believe, early next week. And of course, when I was Cabinet Secretary for Health and Social Care, I also met a number of other victims of Professor Eljamel. And let me start this answer by reiterating just how much sympathy I have for the trauma that they have undoubtedly suffered at the hands of Professor Eljamel. Let me also put on record that a number of MSPs from across the backbenches have raised issues on behalf of their constituents who again have been traumatised by the disgraceful actions of Professor Eljamel, including his own backbench colleague Liz Smith as well. What I would say to Douglas Ross is that as First Minister, indeed Michael Matheson as Cabinet Secretary for Health, we will continue to not just engage with all of those who have been affected by Professor Eljamel's disgraceful actions. What we'll seek to do is get the answers that they want. And that goes to the heart of why a public inquiry hasn't been completely ruled off the table. The reason why we haven't committed to a public inquiry on the issue of Professor Eljamel's actions is twofold. First and foremost, we all know in this chamber that a public inquiry can take some years, rightly so, understandably so. And therefore, is there a way of getting the answers that the victims of Professor Eljamel want? Can we get that sooner? Can we get it quicker, as opposed to often the years and years it can take for a public inquiry? That's the first reason why we haven't instructed a public inquiry. The second reason, of course, is that Professor Eljamel is not in this country. He is practising, I believe, as a doctor elsewhere overseas abroad. The likelihood of Professor Eljamel, I think, cooperating with any public inquiry is very low, and therefore would a public inquiry be able to get the answers that the victims like Ms Mallett and others are seeking. So I will end where I started, which is a public inquiry hasn't been ruled completely off the table, but what we're seeking to do with all the victims of Eljamel is can we get them the answers that they deserve in a way that is quicker and more expeditious than going through a public inquiry.
Douglas Ross.
So if I can take the 2 points that the First Minister has mentioned. First of all, the pace of a public inquiry. Surely the quicker it is actioned and starts, the quicker we can start to get answers for victims like Theresa and so many others. And secondly, we shouldn't be letting Dr Eljamel off by assuming that he will not respond or cooperate. He is a key part of this, but there are others at NHS Tayside and the victims that we need to hear from. Because Ms Mallett told the First Minister on Saturday that she wants people responsible to be under oath so victims might finally get answers that I think the First Minister and I both agree they deserve. The First Minister also mentioned the cross-party support that have actioned this with the current Health Secretary. They met with Michael Matheson in April. He promised an update by the end of May. We're now at the end of June and my colleague Liz Smith has written to him twice in the last week seeking that update. This morning he responded to say he is currently too busy to meet with the cross-party group but will look to do so in the coming weeks. But surely, given these allegations came to light more than a decade ago, we cannot wait any longer. So can the First Minister ensure that his Health Secretary responds to all MSPs who are concerned about this immediately?
First Minister.
Well, as Douglas Ross referenced in his question, Michael Matheson has obviously engaged with cross-party MSPs. I have engaged, and indeed Health Secretaries before me have engaged in this issue, not just with our cross-party MSPs, but with the victims of Professor Eljamel. And it would also be fair to say that a range of actions have been taken to try to learn the lessons from what has happened in this traumatic and tragic case, and to hopefully prevent another case like this happening. But it should be made clear that the responsibility for the actions of Eljamel sit with Professor Eljamel himself, a disgraced surgeon, and therefore it is right, of course, that NHS Tayside does look to learn lessons, but I don't think we should ever, and I know Douglas Ross is not doing this, ever look to abdicate Eljamel of the actions that he was responsible for. Douglas Ross will undoubtedly be aware that a review was commissioned by the Scottish Government, including detailed reviews of the care received by a couple of victims of Eljamel who have spoken out very publicly, and I applaud them for doing so, Mr Kelly and Miss Rose. And that was undertaken by 2 independent consultant neurosurgeons, and the recommendations of those actions have been accepted by NHS Tayside. The reason why I mention that review is that there may be, again, an option short of a public inquiry that will allow an independent review into cases to look and to explore what more can be done, what could be learnt from what is a tragic episode for all of those who have been affected. In terms of Douglas Ross's direct question, of course, Michael Matheson absolutely will respond. I know this is the last, of course, FMQs of the session, but we are going to continue, of course, all of us, I suspect, work right throughout the course of the summer. So I would expect Michael Matheson, he will, of course, make himself available where he can to continue to engage, not just with cross-party MSPs, but also with the victims of Professor Eljamel.
It is indeed the last FMQs of the session. I have many members who are keen to put questions to the First Minister today. Douglas Ross.
Thank you, Presiding Officer. I stress again, this is an issue that Scottish Conservatives, Labour, Liberal Democrat and SNP members met with the Health Secretary about in April, were promised an update in May, have been told this morning it will now be several more weeks. There is an urgency here, and I hope the Health Secretary and the First Minister can agree to update the concerned members today. Give them that update today before we leave for the summer recess, and then there can be further updates through the summer, because there are so many unanswered questions here, Presiding Officer. The First Minister mentioned 2 victims and said NHS Tayside had accepted the outcome of the independent review of their cases, but the victims haven't. One of the patients, Jules Rose, who the First Minister mentioned, says, I have still not got answers 2 years on from the independent review of my case commissioned by the Scottish Government. So how can I be reassured that the new independent review will help patients? That's what they're saying about the current process being suggested by the First Minister. Now, a Freedom of Information request published by the Scottish Government this morning contains minutes of a meeting held between NHS Tayside and Dr Eljamel on the 3rd of June 2013. During that meeting, Dr Eljamel seems to have got off practically scot-free. Junior doctors are blamed in this for mistakes made by Dr Eljamel, and the Health Board seems to accept his heartless promise to, and I quote, maintain the quality of his service. That is just scandalous. So when he was Health Secretary, did Humza Yousaf demand to know from NHS Tayside what they knew and when they knew it?
First Minister.
Yes, I had a range of conversations with NHS Tayside, including with the Chief Executive and the Chair, on this issue of Professor Eljamel. Of course, Douglas Ross will be well aware, and I'm happy to ensure that he gets a written update in this regard of the actions that were taken forward by NHS Tayside. I am not standing here. I suspect, in fact, I know that the Chair and the Chief Executive of NHS Tayside would not say that there were not lessons to be learnt from the tragic case that has affected so many victims, including Miss Rose and Mr Kelly, 2 patients who I have met and that we will continue to engage with. In terms of the specific issues around engagement with patients, there is there has been an established process for former patients of Professor Eljamel to contact NHS Tayside, and there is also an independent mediator that's been appointed to work with NHS Tayside and 2 former patients whose experiences were reviewed by the Scottish Government and 2 independent consultant neurosurgeons. So that engagement with patients absolutely will continue. As I say, there are some outstanding questions that I know patients want answered. I do believe that we can work with NHS Tayside to try to get those answers. There is a request being made by a number of MSPs, by Douglas Ross, for a public inquiry. It's not ruled off the table, not taken off the table, but I do think that there may be other ways to get the answers that Miss Mallett, Mr Kelly, Miss Rose and many other victims of Eljamel absolutely deserve.
Douglas Ross.
The Freedom of Information request that was published this morning by the Scottish Government also shows that complaints were mounting from victims, but in many cases were dismissed. Complaints were growing as well from NHS Tayside staff, who appear to have originally raised the alarm back in 2009. But healthcare professionals say they were warned not to speak out. One whistleblower said, "I did raise concerns at the time, but I was shut down. It went all the way to the board. They knew about it." The First Minister is saying that a public inquiry is not off the table, but he needs to be clearer. He needs to say it is on the table, it is going to happen. The actions of Dr Eljamel ruined people's lives, but the actions of the Health Board suggest a cover-up at the highest level. First Minister, doesn't this simply demand a full public inquiry?
First Minister.
So again, I would take the points that Douglas Ross raises in turn. In terms of the whistleblowing processes in 2009, I think by any objective observation, there has been improvements in terms of the whistleblowing processes. I've met myself when I was Cabinet Secretary for Health and Social Care with whistleblowing champions in our territorial health boards. There have been improvements in the whistleblowing process since 2009, since that particular statement was made by the member of staff. My predecessor, when stood here, did often say, and I will reiterate this point, that whistleblowers can, of course, and should go through the appropriate whistleblowing route, but if they ever want to contact the government directly about concerns that they have, they can absolutely do that too. We take issues of whistleblowing extremely seriously, indeed, regardless of which health board is affected. So again, I will really end where I started in terms of the questioning from Douglas Ross. This is an incredibly serious issue. It's an issue where individuals have been left utterly traumatised. We will work with those individuals, those victims, those survivors, in order to try to get them the answers they absolutely deserve. And of course, a public inquiry is not ruled off the table, but let's look at how we can get them the answers they deserve as quickly as we possibly can.